Who knows me knows that I'm a huge foam rolling fanatic. The reason being is it's a great way to reset the soft tissues and prevent soft tissue overload. So in short, what we're doing with a foam roller is we're lengthening out those muscles. So when we work a muscle, we work it a lot, it tends to get very short and very hypertonic. What happens there is that we get less blood flow to the tissue. And with less blood flow, there's less oxygen and nutrients to the structure. And it's kind of a dangerous place for a muscle to be. With the foam roller, we can lengthen out the muscle and bring some blood flow back into the area. So with CrossFit injuries in particular, one of the biggest ones we see is the shoulder. So I'd like to show you an easy technique to help reduce shoulder injuries. So we're gonna roll the subscapularis, which is up in the armpit, and the latissimus dorsi, which also attaches up into the shoulder. Both muscles attach up in the front here and put a lot of force onto the shoulder, and often put the shoulder in kind of a bad position, and they're usually too tight. So to foam roll these structures, we're gonna put the roller right on the mat, and you're gonna side lie on the roller and put the roller right up into the armpit, okay? And right away, most people will find some sore spots. Now you're right on the attachment of these big muscles. If you tilt yourself back a little bit, you can get a little bit back into the posterior rotator cuff. If you find a sore spot, the rule is just stop, relax, let the foam roller soak into the tissues, 30 seconds to a minute. It feels great. Once you've done with that spot, move on to the next. You can also come forward a little bit onto the pec minor, which is another really important muscle for the shoulder and the upper back and the neck. So you're gonna come forward a little bit. Ladies, just stay above the breast tissue and you'll come forward onto that pec minor. You'll find it pretty easily. Once again, spend some time on it. 30 seconds to a minute is usually sufficient. Right away, once you're done this technique, you'll find that you're able to gain a nice, easy, upright posture. Now, the other really important protocol, I think if we were to pick one muscle of the lower extremity to look after with the foam roller, that would be your quads. So if you think about the anatomy of the quads, we have 4 great big muscles attaching into the kneecap, right? They put a huge amount of force onto the kneecap. These guys are usually always too tight on most people. We kind of forget about them, but they cause a lot of dysfunction through the knee and lower extremity. So I like to foam roll these one at a time. Now, most people foam roll quads somewhat like this. Okay, they hop on the roller, and they think foam rolling means rolling. So they'll get on and they'll go do something like this. And this is just really not a very effective way to foam roll your quads. You really want to think about separating them. Now, the quad muscles that are most commonly affected are the vastus lateralis, so that comes along the side of the muscle here. This has a big issue with the IT band as well, and the rectus femoris, which is right in the middle here. So to get these 2 muscles effectively, I like people to go on the end of the foam roller, one leg at a time. So the side we're not rolling is gonna go up against, you're gonna go bent knee at the end of the roller. The other one's gonna go on the roller, you're gonna start above the kneecap. You're gonna turn that toe in so that you're getting that outside quad muscle, okay? Right away, most people find some tenderness in here. Note that you're in a nice tripod position, so you can take some pressure off the muscle if you want to. You're gonna go ahead and roll along. When you find that really kind of tight area, stop. Make sure your foot and leg is relaxed so the roller can do its job, and let that roller soak into the muscle. You can go all the way up to the top of the hip. Now, to get the rectus femoris, you just let your toe go center in the back here, and then you'll get into a different muscle group. You can really spend quite a bit of time on the quads. You'll just find right away you'll get a relief at any knee discomfort you're having. So this is one of my very favorite techniques for reducing knee pain, and I think you'll find it really valuable.